by acknowledging that we are gathered here today on the traditional territory of the Algonquin people. Welcome. My name is Dr. Melvin Lee, and I'm the owner dentist here at Dentistry at Bank Street Professional Center. Thank you for being here with us today. I'm happy to be joined by the Honorable Mark Holland, Federal Minister of Health. We are pleased to be with you for this announcement, which will provide an update of the claim-by-claim processing for the Canadian Dental Care Plan, which started last month on July the 8th. The CDCP is one of the biggest improvements we've seen to the Canadian healthcare system in decades. Our clinic is very proud to participate in the program and help more people in our community gain access to the oral health care that they desperately need. Please note that there will be an opportunity for media to ask questions following the announcement. Now it is my tremendous honor to introduce you today to Honorable Mark Holland, Minister of Health. Minister Holland was first elected as the Member of Parliament for Ajax in 2004. As a Member of Parliament, Minister Holland has served as Leader of the Government in the House of Commons, as Chief Government Whip, as Parliamentary Secretary to the Minister of Public Safety and Emergency Preparedness. In both public and private roles, Minister Holland has backed health-related initiatives. He served as Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth. Ladies and gentlemen, please join me in welcoming the Honorable Mark Holland, Minister of Health.
Thank you so much, Dr. Lee. It's a wonderful pleasure to be here today. Let me also thank Dr. Pham, who's with us today, for all of your incredible work here in the clinic and all the folks that you're seeing. I also want to take, and you're going to be able to hear from Odina Love, who's the CEO of the Dental Hygienists Association, as well as Kelly Mansfield, the Canadian Dental Assistants Association, Michael Vogt, who's from the Denturists Association of Canada. And folks, we have great news today. This is news that I think blows the front door off the barn. We have been working hard with providers across the country, having conversations about them with folks like Melvin and like Dr. Pham around how we create a program that works for patients and for providers. Today, I'm here to say that nearly 450,000 Canadians have received care. There's 2.3 million Canadians who have signed up. And as a result of working with providers to create an alternate claim-by-claim pathway, we've seen an explosion in provider numbers. More than 6,500 new providers have participated in the program using claim-by-claim. That takes us to 19,000 providers across the country who are providing services to Canadians where they need it across the country. That represents 75% of oral health professionals. To break it down for dentists specifically, that number's over 70%. So this is huge news. Now, we're not stopping here. Obviously, we're working with the associations to make sure that we answer every hygienist, denturist, and a dentist question, that we work on any obstacles that we have. We're not stopping until we get to 100%. 75% is huge. Think about it. Just a month ago, before we launched the alternative pathway, we were at about 50% of providers. So in a period of 3 months to be at 75% is incredibly important. But let's talk about what does that mean in a practical sense. You know, as I've traveled the country and I've had an opportunity to talk to people in different parts of the country, let me start here with Melvin. Melvin, you and I had a conversation just before the press conference. Melvin was saying to me, you know, he's a golf enthusiast. He's got a better game than I do. But Melvin met a 15-year-old who asked him, like, why is oral health just not part of our healthcare system? Why are there people who can't get access to the oral health that they need? That is a profound question. And it's a question of what kind of country we live in. We want to live in a country where seniors are able to get the care that they need. You know, I think of the conversation that I had not too far from here in Vanier. It was in the early days of launching the program. It was with denturists who were brothers, Dan and Jack in Vanier. And the denturists were talking to me about the clients that they were seeing who had 30 and 40-year-old dentures. One lady, 42 years without a pair of dentures in her mouth. What she was left with was plastic plates. And I talk about this often because it sticks with me. When Dan and Jack were talking to me about the senior who was forced to use these plastic plates to chew their food with no teeth in their mouth, it just profoundly strikes me that this is not the country we want to live in. And imagine the sense of dignity, the sense of being that comes from having those teeth placed in your mouth. When I was at the Faculty of Dentistry and I had a chance to talk with Ryland. Ryland is a dental student. He talked about a couple of things. He talked about the pain of somebody with an abscess in their mouth and the inability of them to get care. But he also talked about people who came in and were able to get fitted for dentures and how they came in with their best clothes and they had those dentures placed in their mouth and 10, 15 years were washed off their face, and how excited they were for family photographs, how excited they were to go and go into a job interview. This is fundamentally the dignity that we're trying to talk about. You know, and I heard that again from Navjeet when I was in Windsor, who runs a mobile hygienist clinic. And Navjeet talking about the people that she could go in different communities and how they felt seen and cared for. Seniors feeling like somebody cares about me. You know, and Melvin, you talk about when you were a young person, you didn't have access to oral health care. That was your passion for entering this profession. And I want to say how moved I've been as I've gone and had the opportunity to talk with denturists and with hygienists and dentists to hear their stories about why they want to provide care. And that's what this program is about. We have 9 million Canadians to get to. We have 25% more oral health professionals to get there. But today is an important day in our progress to make oral health a part permanently of Canada's healthcare system. And with that, Melvin, I'll turn it back to you.
Thank you so much. Thanks, Melvin. I appreciate it. Again, thank you so much to the minister and also the government for starting this, basically, for me, once-in-a-lifetime healthcare initiative. Now I'd like to introduce to the podium the president of the Canadian Dental Assistants Association, Kelly Mansfield.
Good morning. Thank you, Dr. Lee. On behalf of the Canadian Dental Assistants Association, we're very happy to be here today for this fantastic announcement. I'm sure we can all agree, oral health is essential to overall well-being. The Canadian Dental Care Plan will provide dental care access to nearly 9 million eligible Canadians. This has the potential to not only enhance the quality of life for these Canadians, but it also has the potential to reduce some of the burden on the broader healthcare system, where people often turn to when they have no other options for their dental health needs. The feedback we are hearing from our CDAA members regarding the administration and clinical implementation of the CDCP has been both positive and rewarding. Several members have shared personal stories of how the CDCP has enriched their well-being and happiness. Several members, for example, one member's grandparent who hadn't visited a dentist in over 20 years, despite struggling with ill-fitting dentures that impacted their ability to eat, recently received a new set of dentures through the CDCP participating provider. This care, previously unaffordable, has significantly improved their daily life. Dental assistants, who are essential members of the oral health team, often lack coverage for themselves and their families. For them, the CDCP represents a meaningful opportunity for them and their families to potentially receive the dental care benefits they have dedicated themselves to providing for others. Consequently, widespread acceptance of the implementation of the CDCP may also contribute to reducing the dental assisting shortage across Canada by attracting new individuals to this vital profession. A longtime friend of mine, a single mother working without health benefits, prioritized her child's health over her own, like many parents do, due to financial constraints. When she finally visited a dentist, no longer able to ignore the pain she was experiencing, she was diagnosed with oral cancer, which she battled for a few years before sadly passing away at 57. Given that dentists perform oral cancer screening during routine checkups, access to the CDCP might have saved her life. The Canadian Cancer Society estimates that in 2024, approximately 8,100 Canadians will be diagnosed with some form of oral cancer, and 2,100 of those diagnosed will die. With increased access to oral care through the CDCP, oral health professionals can potentially reduce the negative outcomes of oral cancer and other oral diseases through early diagnosis and treatment. As dental assistants, we provide a crucial role on the oral health team, serving as a second set of hands in four-handed dentistry. Furthermore, the scope of practice for Level 2 dental assistants permits them to perform most preventive treatments under the supervision of a dentist. And like all health professionals, oral health providers have an ethical duty to provide the best access to care for our patients. The CDCP presents an opportunity for us all to provide this care for Canadians. We encourage all Canadians to review the CDCP eligibility requirements and apply online to access oral health benefits for you and your family members without delay. Along with our oral health professional partners, the Canadian Dental Assistants Association is proud to support this critical program as it aligns with our vision for a strong and safe oral health care system for all Canadians. We strongly encourage all dentists to participate in the CDCP to help eligible Canadians benefit from this program. Thank you.
Okay, so I think now we're ready for questions. Unless Matt, I'm turning it over to you. Okay, fantastic.
Welcome everyone. Bienvenue à toutes et à tous. I'm Minister Holland's press secretary. Je suis l'attaché de presse du ministre Holland. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question with one follow-up. Nous commencerons par les questions dans la salle avant de prendre les questions de Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Rachel Aiello with CTV News. There have been examples of providers describing situations where patients are... Rachel Aiello, CTV News. There have been examples of providers talking about instances where patients have learned that they might not have full coverage or the entire dental care program might not be quite free. So as this program continues to expand, does the government need to do more to improve the communication around this so patients going ahead know what they are and aren't going to get covered?
Yeah, it's a totally fair question. And I think that, Rachel, there are folks getting care all across the country that's deeply affordable. But it's not always free. There are some instances where there's a difference between the fees, the fee guide that we have and the fees that the professional is charging. So there can be a differential there. So I've been very clear throughout my time as minister that difference exists. It's called equal billing. And it's important that people understand that. And for the 450,000 people who've gotten care, they've been able to go in, have that conversation. They get an estimate of what the work is and what is covered. And in the vast preponderance, it is covered. It makes it deeply affordable. I was talking to somebody who had to get 4 root canals. That just is impossible to pay out of their own pocket. And there was a small cost, but compared to what that cost would have been without coverage, it would have been totally prohibitive. And what it would have meant is that person would have lost those teeth. So that's the objective of this program, is to make sure that everybody has access to affordable care. And I think one of the things that works, and one of the reasons why you've seen such an explosion of provider numbers. I mean, this is it certainly exceeds anything I could have hoped for in the first 3 months to have this level of participation, is because it's a genuine partnership. You know, that there is a lot of times in other oral health plans, you know, if you're an oral health provider and you're in a different community, your circumstances can be totally different in Corner Brook than they could be in downtown Winnipeg. And this plan allows you to have autonomy and recognizes that you're going to have to look at that situation. And that's part of what this provides. And I think that flexibility is a great meeting of both respecting that professional independence and making sure that care is deeply affordable.
Just to follow up on another topic, there's been conversation in recent days about the use of bot farms on social media. I'm just wondering, from your perspective, is that something you're concerned about heading into the next election? And do you think the federal government or the Liberal Party needs to do more to try to combat the prevalence of these bot accounts?
Well, I don't know about you, Rachel, but I mean, you know, you go online, I don't stay very long. It's, you know, it's pretty toxic. And we wouldn't talk to each other on the street like that. And there are certainly forces in the world that are autocratic and seek to undermine democracy, who want to fuel divisions that are between us and get us to talk to each other in incredibly disrespectful and cruel ways. I think whether or not it's a bot or a human, when somebody is speaking without humanity, when somebody is hiding behind, you know, username 12768, and they give you their opinion, and that opinion is toxic and makes people feel bad, then we have to think about as a society why that's allowed. It took us a long time with newspapers and television to figure out, you know, how it worked. And there were some dark forces that used those new mediums in very nefarious ways. And I think we're seeing that here. There's too much toxic negativity. An opinion is fine, but the cruelty with which it's being unleashed should be rejected. And I think we have to be very circumspect, unfortunately, about what we see online. There are forces that are running these bots and trying to overwhelm the internet to give an appearance of a particular opinion or a consensus around something that simply isn't true, and at worst is seeking to undermine our democracy. Yeah, we can pass it back there, yeah.
I'm sure you've seen in the States quite the turnaround the Democrats have had. They made a major change at the top of the ticket and they've turned their fortunes around significantly. I'm sure you don't want to see the Prime Minister leave, but do you think the Liberal Party needs to make a major change to their program to see a similar turnaround in the fortunes that you have relative that Democrats have been able to do in the U.S.?
My instinct is we are in very difficult times. These are the most difficult times that humanity has lived through, certainly since the Second World War. People are tired. People came out of the pandemic exhausted, and then they were dealing with a war in Ukraine, and then they're dealing with global inflation, and then they're dealing with the tragedy that's unfolding in Gaza, and it just seems way too much. And, you know, I get an opportunity to talk with my G7 partners. We're not alone. This phenomenon is absolutely everywhere. What I think we're seeing in different parts of the world is really an ignition of hope again. That, you know, maybe the darkest days aren't all that are left for us. Maybe that there are things that are good in this world. And maybe the time that we're in, as tough as it is an opportunity to make things better than they have been. You know, I had an opportunity for my mom's 80th birthday to be away and be in the Olympics and be able to watch Canadians compete. I had an opportunity to watch a movie that I thought was a good idea to watch with my stepchild called Bring It On. Is from the year 2000. You watch that movie, you want to go back to that, right? Like, you watch that movie, you go, what was wrong with us? So we've come a long way. But look, it's a lot easier to sell fear. It's a lot easier to say, doesn't things suck? Doesn't it feel awful? And just to wallow in that. And that's what Pierre Poilievre offers, an opportunity to wallow in all that's bad and broken. And yeah, it's a lot harder to stand up here. It's a lot harder over the last number of years to work with people to say, let's do something totally new. Let's take all of these 9 million people who don't have access to care, and let's fight every single day to make sure they get it. 450,000 people have care today that didn't have before. There is something fundamentally important about that. And instead of Pierre Poilievre, you know, going on about what's broken, what is he going to do about the 9 million people who don't have oral health care? What is he going to do about the cost of diabetes in this country. Diabetes costs this country over $30 billion a year. What's his plan? We have one. What is he going to do about contraceptives for women to make sure that they have access to the reproductive medicines that they need? They got no plan for that. So I think Canadians are fundamentally fair. And I think what they aren't looking for is a new slogan or, you know, a new twist of phrase. They're looking for people to deliver. And what I and my colleagues and the Prime Minister have been doing is every single day working to deliver. And I think today is an incredibly important proof point in that.
How, after 9 years in government, can the Liberals in the next election convince Canadians that they are the party of hope?
I think by demonstrating change, by demonstrating delivering results. I can only speak, I can speak for a lot of areas, but I'll just speak in the areas in which I just did. When I go to the doors, I really believe there are two fundamental messages in the next election. The first one is take what you got, you know. Maybe, you know, don't hope for more. If you're a senior, don't hope that you're going to get oral health care or your diabetes medication. That's too much to hope for. You know, hope is made real by results. And I was in, I'll give you an example of the point that I'm making. I was in Kingston. I was at a town hall with a large group of seniors. And there was a senior, she's loving the dental program. This dental program is amazing. And another senior, I hate it. It's awful. And I said, okay, well, why do you hate it? She said, well, because now I've got a crappy dental care plan that was from my employer, and I'm stuck with it. And now my friend next door has got a better plan than me. That's the escalator of hope. Somebody who was the luckiest senior in her friend group is now the unlucky one. And so they see that things are getting better. I think what's tough is when we've gone through so much as a world, believing that things can get better is hard. You got to see that tangible proof. That's what we got to do over the next year. Over the next year, in my portfolio specifically, I've got to make sure the 9 million people who don't have care, that I have done everything, that I've worn my shoes to the ground to make sure that every person who doesn't have care gets care, or in diabetes medication, or in improving our healthcare system, improving primary care. You know, I could go on and on and on, and data. I think that fundamentally is what people are going to care about. Right now, folks are not focused on an election. They're focused on the fact that the world is tough. And, you know, we can meet that by telling them, yeah, it's tough, and hold a mirror to it and make them feel worse. Or we can talk to them about solutions. That's a harder path. It's a more difficult one, but I think it's the one ultimately that will be more rewarding.
Hi, Minister Holland. Marina von Stackelberg with CBC News. The Conservatives have put out a release about the dental care plan this morning, calling it a program riddled with chaos, backlogs, red tape, and higher costs. They do point to a survey, an online survey that the Canadian Dental Association did, which showed that nearly half of seniors that they surveyed felt that there was miscommunications, confusion over how the plan worked. So what is your response to what the Conservatives have to say here?
Well, Marina, it's rich, right? The Conservatives saying, oh, there's confusion about this program. There's chaos about the only chaos of the program is from the Conservatives, right? The Conservatives saying there are all these problems. I've just listened to what you just asked me and put that against the reality of what I just said. This is the largest federal program ever launched. In 3 months, 450,000 people have got care. To put that in stark terms, that's 450,000 people who did not have access to care before. This is people who have teeth in their mouth as a result of this program existing. So it's a little rich to me that the Conservatives' chief argument against this program is there's confusion and misinformation when they are the originators in chief of that misinformation, right? So I would say to them, look, fine, you want to be against this program. Okay, then be clear about it and be honest about it. The Conservatives have gone from saying it doesn't exist to saying it's too confusing. If their health critic wants to debate with me on the merits of how confusing it is, welcome. You won't find him doing it, right? What's confusing about it? It's easier to use than private insurance. Providers are getting paid in less than 48 hours. I defy you to find me providers who are using the program that are having problems with the program. But I can find Conservatives who are desperate for it to not work. And I think it says something fundamental about their interest. Their interest here is a political one. And it goes back to the question that I came before, and it's an instinct I have about Canada. I think this country is interested in results. I think they're interested in seeing us lift Canadians up. I don't think they're interested in finding divisions and trying to create problems. And what I think has been able to work, and you look at the bilateral agreements that we've done with provinces and territories, we were able on aging with dignity and on working together and on primary care, we were able to get agreements with every province and every territory in a spirit of cooperation. I think if the Conservatives want to win the next election, they should have the best ideas. If they want to win the next election, they should show how they're going to make the country better than we're making the country. But trying to set fire to things that are working because they're afraid politically it's going to be bad news for them, I just think that's, well, frankly, disgusting.
What do you make of the NDP's call to the election commissioner to investigate what's behind the social media post that followed Pierre Poilievre's rally in Kirkland Lake last week? What do you make of that call?
I think you know, the NDP is certainly free to do what they're going to do. I think there's a lot of questions that have to be asked about the forces that Pierre Poilievre is playing with. There does seem to be, at its heart, an interest to light things up, to create more problems and find divisions. I don't know what's going on behind a lot of what's going on there. To be honest with you, I try to stay off social media. What I try to do is wake up in the morning and go, how do I make dental care work? How do I get an agreement on pharmacare? So that's really where I'm going to stay focused. Those are fair and legitimate questions, but probably I don't have really a lot to add more than that on it.
There's someone who wants this.
Sorry, from my colleague Laura Osman. Are you still consulting with the dental associations to develop the pre-authorization process?
Absolutely. So the Dental Association, so I had a conversation yesterday with the head of the Canadian Dental Association. They have stated that they've received a legal opinion that they can't be either for or against the Canadian dental care plan. So they're going to have sort of a neutral position going forward. But we're working with them and all providers, so the hygienists and the denturists and certainly the dental assistants to make sure that the pre-authorization process works. You know, you would have heard that the process we have now has been very user-friendly, and we want to continue that. We want to make it as simple as possible for providers to use. So we have working groups that are chewing through this, and we're engaging all of the different associations, and are going to continue to do that. And we're on track in November to be able to deliver that pre-authorization process. That's incredibly important because we have a lot of folks with more complicated oral health needs who are going to need to access that to get the care they need. I think is that it in the room? Okay, we'll go online, Matt. We'll borrow that back just to go, because I think the folks can't hear us online unless we...
Okay. We will now proceed to questions from journalists online with Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
Okay, merci, Matt. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Just give it a few moments. All right, no questions online, so this will conclude today's news conference. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
Recording stopped.